The November 17 simulation is actually part of our Department of Defense project to create a hands-free solution for the battlefield medical operations so that we can allow medics to help save the wounded soldiers while we can record all the information about that process using video and audio recordings.
Most often there's no documentation whatsoever of what happens to a wounded soldier out in battlefield. The first priority is getting that soldier out of harm's way and getting them into an environment where they can be properly treated. When that soldier moves on to an evacuation team and into a helicopter and off to a fleet hospital, all that time there's just no one documents what happens. And so this is a real challenge.
So taking video audio recording in a battlefield to work with the soldiers, you can definitely imagine that, but then the noise is really killing it. And to really deal with the noise, you need to have almost perfect solution of noise cancellation in a battlefield, which is considered not possible today.
Early projects tried to collect the data, analyze it on the spot, and there's just too much going on. High temperatures, wind, sand, other things that can get in the way, and so that separating that out into two distinct processes.
First, let's record the video and audio as the source information in the battlefield. But we don't have to cancel the noise right at that point. We have enough time to take that information back home, and then we will have our big computing infrastructure to cancel that noise in that information. And eventually those information will be integrated into the patient's electronic health record.
If there's nothing documented in the record about what the scope of the injury was, it adds a lot of frustration. There's a lot of documentation, paperwork, delays, all at a time where this wounded warrior is trying to heal and often transition into civilian society.
We want to help the military see that it is possible to reliably collect the information you need, and with advanced algorithms, we're going to continue to improve the amount of information you can accurately extract. That really speaks to what Clemson has been driving a lot of its recent research activities. It's really to try to think out of the box. Taking a technology research in the existing form and try to imagine what's possible in the future.